Hi everyone, it's Pete here from the Paint Toolkit, and today or tonight, or it's good morning to Lou. We're with Lou James from Pink and Steel over there in New Zealand. I'm going to say good evening to you, Lou, but you're going to say good morning to me. So why don't we just say good day?
Good day, Pete.
Good day, Lou. Lou, I've always wanted. I know we met recently. Say recently, last November when you was over in London doing some training. And he was telling me about the work you do at Pink and Steel, and I've been following your stuff that you do via all the information that you put out via social media on Twitter and Facebook, etc. And for me, what you're doing here, I find it exciting because I think it's so proactive and it's so upbeat and so informative. I mean, for me personally, with my stuff, like I've learned quite a lot from you. But Lou, and I suppose, so we've organised this sort of interview, but before we go any further, do you want to sort of introduce yourself to the people watching the broadcast and just sort of who you are, what you do and stuff like that, and then we'll have a little bit of a chin chat.
Okay, thanks, Pete. Thanks for talking to me. So I'm Lou James, and I I qualified as a physiotherapist in New Zealand in 1987, so it seems like a long time ago now. And when I first started working, I mainly worked with sports athletes in New Zealand. And then I started seeing a lot of people affected by cancer. And I realized that the services in New Zealand for those people were polar opposites to the athletes that I was seeing. So in New Zealand, if you are an athlete or play sport, then you get a lot of physiotherapy treatment funded and a lot of support, whereas the people that I was seeing that were affected by cancer, who often had chemo and surgery and radiation and a whole lot of treatment, were left to try and rehab and recover themselves after their treatment. And I just didn't think that was fair. So I started doing a lot of research and work on how I could help them. And I realized there wasn't really a lot worldwide at the time when I started. This was in 2005 when I first started my first program, which I called the Pink Program, and that was to help women affected by cancer, because at the time they were the people that I was seeing the most of in my clinic. And I actually got really good outcomes really quickly, and it wasn't rocket science that I was doing. You know, what I was doing was I was listening to what was going on with these people, what impact the treatments had had on them personally, and then I was helping them with their body. So what I kind of found was that the medical team are doing a really, really good job now at getting rid of the cancer. People are living a lot longer after they've been diagnosed with cancer and have been cured from their cancer, but they're often living with long-term side effects of this treatment. And people are often not necessarily telling their medical people about some of these complications. And I think, you know, some of them feel lucky that they've survived, really thankful that they've got rid of the cancer. But these long-term consequences that they are getting doesn't necessarily mean that they are living well. So I became really passionate about trying to help them, because I understood that it often wasn't that hard to make a real big difference to their quality of life, to their function, to their ability to sleep, to their ability to move, all those sorts of things we could have an impact with. No, we can't control cancer. The treatments are doing a really good job on that, but we definitely can help quality of life. But now, since I've been working, I started a program for men in 2011 called the Steel Program, and again had really, really good results. So now we help men and women and young people with any type of cancer rehab and recover. And what we've found from the about 15 years that I've been doing it now is that, you know, the earlier we can intervene, the better. So if we can actually see people pre-surgery, that's much better. If we can see people and we can get their norms, if they have any comorbidities or problems before they go into surgery, that's going to affect their outcomes coming out of it. So if we can see people before surgery, then that's a really good step. If we can't, sometimes surgery is scheduled quickly, then post-op. If we can help people help themselves, and I know you know all about that, Pete, but if we can help people self-manage, and so that they recover faster, they know what they can do, they're not just told what they can't do, they're told, you know, this is what you can do to help yourself, these are the things that will help you sleep, these are the things that will help you feel better. Those are the things that our physiotherapists will tell people. And then we actually now work a lot with people during treatment. So during chemotherapy and radiation and hormone treatments, during treatment, to try and help them improve their energy during treatment, help them with all sorts of things that treatment may affecting them, so that they can improve their quality of life. And what we've found when we help people during treatment is they're often in a lot better position after the treatment. So they're not quite so deconditioned, fatigued, they haven't been quite so beaten up by all the treatment they've had, because they've had intervention during. And then a lot of the times we're helping people afterwards, because the consequences of the treatments of cancer affect people for a long time, and some of those side effects don't show up to longer. So people can look perfectly normal on the outside, the cancer can be gone, but they can be really struggling with a lot of impairments that those cancer treatments have given them. And again, we can help. So my main role now is actually training I train physiotherapists and occupational therapists on how to help people that are affected by cancer. And it's a really comprehensive area. Cancer rehab is a really large area to train physios in, because there's not just one cancer, there's hundreds of different types of cancer, and they all manifest themselves differently in each person. So their impact on everyone is different. Even people with the exact same type and grade of cancer will be affected differently. So it's an individual thing, and it's a large area, but it's a really rewarding and exciting area to work in, because we can make such a big difference to people's lives.
You know what, as you know, I was diagnosed with prostate cancer in 2016, and I think the first few certainly the first few weeks and months, really, I was hitting a lot of speed bumps. But I was going to rewind. I might come back to that a little bit later on. But I've been involved in the pain sort of stuff now for quite a few years, and but I didn't, I think you learn more about something when you got it, not when you haven't. I remember there's a really nice pain doctor oncologist, a guy over here called Sam Medzia, and I think he's retired now, but so he still does bits and bobs, etc. with the Pain Society, British Pain Society, and he approached me quite a few years ago, and asking me about if I could design a program for people who have, as you said in what you just said, where people have had their cancer treatment, but they're in remission, but the treatment they've had has been so severe, they're left with this persistent pain, and they're pretty much left to their own devices. They've the good news is, Mrs. Smith, that sure, great, the cancer's in remission, and get on with your life. But the radiotherapy, the chemotherapy, and all the other sort of treatments people have, it's attack their joints, so they've got painful joints and bits and bobs and stuff like that. But they was pretty much left to their own devices, really, on how they treat it or manage it. So unfortunately, we didn't get any far. With myself and Sam, we didn't get any forward with putting anything down. But there was some intensive sort of talks, and like most things, they get sort of put on the wayside. So when I bumped into you guys, the stuff that you're doing, to me, it just makes so much common sense. Where for me, I'm not a medical person, as you know, and I'm just a common, not the sort of normal dude in the street. And the stuff what you do is how you create a program pre-treatment, during the treatment, and post-treatment. And I thought to myself, bloody hell, that's common sense. And I tried to sort of do a bit of investigation here locally, like with my local hospital and stuff like that. And I was getting bits of information back from them, but it was all very bitty, and I felt that they thought, well, hang on a minute, we really don't do that, but it's giving me a lot of dodgy answers, sort of thing, And in the end, they stopped. I kept trying to do a bit of digging, but in the end, they just stopped replying to me. So I sort of pretty much gave up. And how I manage my pain, I thought, well, I've got to, I'm going to have to try and do the best I can, But I found so much information from your site and the stories, I'll give you one example. When there was a guy on a video there who had prostate cancer, and he was saying that he had to up his strengthening exercises because the hormone treatment, like what I have, can cause osteoporosis. Well, no one would tell me that. You know, that was like another bit of a secret. And what I learned from that, so what I did, I had to adjust the program that I use in the gym while doing more strengthening exercises. You know, so the stuff that you're putting out is, to me, is valuable information, but information that people don't normally get. Why is it? Can I need to ask you a question? Why is it that the majority of people don't get this sort of information? Like, I'm not, you know, the oncologist and all the other people that work in tandem with them, I guess the nurses, etc. I mean, they seem quite skilled with stuff, but for some reason they lack that bit there where why don't we get told basic information like that about the importance of keeping active and exercise?
Interesting question, Pete. I mean, I've thought about that question quite a lot myself over the last decade about, you know, about the information people get. But I think really the focus within the hospital often is on the cancer and on that immediate needs of that person. And as a physiotherapist, when I was working in the community, we saw the impact of that, and I don't necessarily think that they have seen the impact of some of those treatments on people when they're out of the hospital. But also, I mean, their role is really important in getting rid of the cancer. But what's happening now is that rehab has never been on the clinical pathway for cancer patients, because in the past people passed away. So I know in New Zealand and in the UK, if you have a stroke or a heart attack, there's a lot better rehab pathway. So people within the hospital know that people should exercise and what they should do, and the pathway's there. But I think with cancer, it's a newer area. People are surviving now, so it's something that I think should start being addressed a lot better. Well, hopefully will be addressed a lot better. I think one of the things is, though, that sometimes when people are affected by cancer, the impact of those treatments is an accumulative effect. So the more the treatments have, the more impact that they have. And once they leave hospital, some of those things can manifest themselves worse. So they're not necessarily seeing the impact of those treatments on people, I don't think, early on. But as you said, there's a lot of research now that indicates that people that have had cancer treatment have an increased lifetime risk of getting osteoporosis. They're more likely to have cardiovascular disease. They're more likely to get diabetes and functional decline, and they're actually more likely to get another cancer recurrence. So we should be helping to them manage themselves so they don't get, so they don't get those things. That also, so one of our really big focuses is on exercise and activity, because the research is just so strong on how that can help people affected by cancer. But there's so many barriers for them to do that. They need help. They don't just need a brochure saying you should exercise, Pete. Often people need some help because they might have pain that they're dealing with, and they don't know what sort of exercise to do, or all those sorts of things. And obviously there's specific types of exercise that you need particular to your body. If you're trying to build strength because you're on androgen deprivation therapy, then you need to really focus on certain exercises for you, and other people may be focusing on something else. So exercise is extremely valuable for people affected by cancer, but if it's targeted to your individual needs, it's even more powerful. And I think people need information about how to do that. So people within the hospital setting aren't necessarily trained in that. They're focused on their area, which they do really well. And I think what needs to happen is a better pathway, so that people are referred to people where this is their speciality, where they have done extra training, where they understand, and they can provide information to the individual about how they're going to get themselves strong again, and how they're going to prevent some of these long-term consequences. But also, there is evidence coming out now that if people get rehabilitation and go back to regular exercise, they can decrease their healthcare costs, because they, if we can pick up impairments early. So one of the things that we do as Pink and Steel cancer rehab therapists is we assess people from the impacts of their treatment. So hopefully we're doing that regularly, but if it's at the end of the treatment, we'll assess the impacts of the treatment on you. So that's not just where the cancer's taken away from, that's your whole body. What is the impact on your whole body? And then we design a program to help you specifically. But if often in those assessments, we pick up on things that could lead to further problems, and if we pick them up early, we're much more likely to treat them easier, quicker, and more cost effectively. Like, for example, it's about 70% of women that have mastectomies get shoulder problems. And if we can pick those up early, we can prevent them from getting frozen shoulders and a lot of different things. Same with head and neck cancer patients. If we can pick problems up early after their surgery and their radiation, then they're far less likely to develop other musculoskeletal problems and things further down the track, which then costs a lot more money. So as you were saying, the not waiting till the person is in flames, trying to pick them up, before they get to that point. And I think that's the crucial step. If we can pick those impairments up early and help people help themselves, then we can actually save them a lot of money. We can save a lot of suffering and a lot of unnecessary disability because we've picked them up early and we've put people on the right path. And hopefully, the message is getting out there now because there's so much robust research about activity and about cancer rehabilitation that message is going to go back to the oncologists and the nurses and the people working within the NHS and the hospital systems that, people need support for a long time. They need to look into the community and see what things that they can do that are going to help them on a long-term basis. Because it's not good enough just to help them for the 12 weeks after their treatment. That we need to be getting them to do activity and things for the rest of their lives. We need to build it into to how they're looking after themselves. So that often requires some good support.
See, I see myself as one of the lucky ones, really, because back in the day when I just had back pain back in the early 90s, I was lucky enough to get myself on a pain management program. Where on that program they got me started off exercising because I was like the usual people that you see that, well, how the heck, what do you mean exercise can decrease my pain, can make me feel better? What the heck, give me a pill, And I was one of these dudes, And so what I learned on that pain management program were lifelong skills, which are all transferable. So absolutely. I learned these skills of the importance of keeping active, stretching, exercising, pacing my daily activities, doing some relaxation, the package, and that package keeps me in the driving seat. So for me, doing, when I found out I had to do more strengthening exercise, it wasn't a big deal for me. So, okay, fair enough, I'll do it. But I still, as it goes back to the pain management program skills, as I say, all lifelong skills that I was able to transfer as I've become an older guy. I've got arthritis and other bits and bobs in my body. But again, all the pain management stuff, all transferable. But it's about how you getting people where they need to hold that. When you learn to drive, you drive a car, didn't you? Did you drive a car?
I rode a motorbike too, Pete.
Yeah, my babe, you're smoking red hot, baby. I'll tell you what. I'll show you. I'll send a picture of my new bike. I call it the Beast. And the thing is, when you learn to drive, did you learn to drive on your own, or did you have some help with a driving instructor? Whereabouts did the driving instructor sit? Did he sit in the passenger seat, or the driving seat, or the back seat, or did he stand outside the car? Whereabouts was your driving instructor?
I grew up in the country, Pete, in a very rural place in New Zealand. So my driving instructor would have been my dad, and we were on the farm. And
whereabouts did your dad sit?
In the passenger seat. Exactly,
because you was in the driving seat, but your dad was there to give you a bit of support and to get you going and get your confidence going. Mm-hmm. And it's exactly the same for people who need that little bit of support and help just to get them started. And once they got the hang of it, they're on their own and they're off and running.
Absolutely.
So and as you say, giving people the leaflet, here's a leaflet, off you go. A lot of us, but we're not into leaflets. And it's we're more, I think, but especially people in pain, persistent pain, we're visual learners. We like having information via videos and other audio and whatnot.
Yeah, I think too there's a huge psychological impact that cancer has on people, and when you can help them be in the driver's seat, you also definitely help them mentally as well as physically. So I totally understand what you're saying. I think it's really important that we're giving people the skills that they can look after themselves for a while, and that does, I think, requires individual attention. How the model that we use with Pink and Steel is a pyramid, and it's the opposite to an educational pyramid. So in the education system, you start in a large group, and then if you have a learning difficulty, you might go into a smaller group, and then if you have more of a problem, you might have individual care. Well, we reverse that for cancer rehab, and we think it's essential that you get individual programming first, and that doesn't necessarily need to be for long, but you need to be assessed individually for the impacts of cancer on you. Everyone is different. And then you can go into small groups. So if what we have in Pink and Steel is we have some small group programs, exercise programs, and they're really great because you also get the social connection of those smaller groups, and you meet other people that may be impacted similarly to you, and I think that's really important because a lot of people affected by cancer can feel quite isolated, so they can get, and also they meet people that they can exercise with, so they might then start going to the gym with them afterwards or walking with them or things like that. So we have small group programs with other people affected by cancer. But then my big thing is we need to then get them into the next tier down, and that's community. Get them back into the community, get them back doing things that they can, as you say, do for the rest of their life. So integrating them back in. And so that's the pyramid that we use. And I think, people do need individual care, but then there is definitely room for them to go into groups and then get out into the community, because people don't necessarily need to be labeled a cancer survivor or feel like they have to be in that forever. They want to move on and live their lives fully and actively as they can. So we try and integrate them right in towards the community. And some people might not be able to do exactly what they did before their cancer diagnosis. There may be modifications, but we've had a lot of people that have come through our programs that have gone on to do things that they never did even before they were diagnosed with cancer. So it's a huge boost to their confidence, and they really want to live their life really well. So it's great to be involved in that transformation, and I find it so rewarding.
Let me ask you just a couple of questions before we end. You mentioned now about how you engage people and all that, but how do you help people perhaps live in a rural setting? So, say for example, they can't get to the group because of poor transport or something like that. Do you do online support or online teaching for patients?
One of my because I come from a rural area, as I mentioned, and one of the things that I really feel strongly about is often people in rural areas get even less support than they do in the big cities, and I think again that's really unfair. So one of the things that I've done is personally is I've tried to it be my mission to train more therapists in those rural areas. So there are a lot of physiotherapists in rural areas, so Pink and Steel offer scholarships for them so that they can do our training and so that they can help people in those rural areas. So we have a lot of smaller areas now. There are a physio, and again people often have to go into the big centres to get their treatment, but then they come home and then they have the support there, which is great. And obviously if people are more rural than that, then we try and use those physiotherapists to do, whether it's tele they might have to come in once to get their treatment, and then they can get a program, and they try and then help them from there in other ways. I have been working with a group in New Zealand of young people affected by cancer. In New Zealand, they have a charity called Canteen, and that's for people that are between 13 and 24. And I work with them, and they have some camps, and then we've developed an app that we use, which we go through all the exercises with them first, and then they have a program that they can go through with support of physios in their region. So we are trying to use a bit of technology, but as I said, I do think that people need individual care first, but we do want to make sure we're reaching people in all areas. So we're trying to make sure we can do that. So we do a bit of tele conferencing and online stuff like this. Because people do need to be able to talk to someone, I think, and air their concerns. And you need, as their therapist, you need to find out what matters to them and what's important to them and help them address that. You know, it's no point just telling them to do things that you want them to do. You've got to find out what matters to them so you can try and help them in the best way you can.
Okay, last question. So you do all your main remit is, you're supporting your patients in the area and whatnot, and you're doing all these lovely training courses. When is the training that you do, is it mainly New Zealand? Or I know we met you last November in London, where you were doing some training. I mean, have you got any plans to do training more training outside of New Zealand? Perhaps are you coming back to London, or where are you going to Europe, and whereabouts? How can people access your training?
Well, I train people in 11 countries now. So, but
11?
most of my yes, I know. Most of the training I do now is online. So you have to be a certified physiotherapist or occupational therapist to do the training.
Okay.
And you can apply online, and so I only select therapists that have good experience. And so I'm not training them to be a physio or an occupational therapist. I'm training them to use the skills that they have to be able to help people affected by cancer. And we don't just look at one cancer. As I said, we're looking at different, a lot of different types of cancer, the impact of the treatment and how we can best help. So a lot of the training is a 12-week online program, and we do a lot of online webinars like this where we get involved. And so people often will have, about 10 people on the screen is the maximum that I have, and you can hear from other therapists and share, hear from them as well, which I think is really cool. And I do, as you know, do practical courses as well. So I'm coming to UK again next year. I'm coming to Geneva and then Ireland next year. Going to Canada next year, and I go to Australia each year. But most people can access my courses online. They just need to apply at pinkandsteelphysios.com and or email me, and I'll send them information about the courses.
And as you know, Lou, it's on my agenda to pop over there and see you guys anyway. And
yes.
So I need to organise that. So I've been saving up the money. I've been I don't know. I call money Wonga. I've got the money. I've been saving up the Wonga, but what I need to do is just get the all clear again from the next sort of oncology review next month. And once if I get a green light again, which I'm pretty positive I'll get a green light, then all I really need to do is to organise the flights and whatnot. So pop over there back end of the year, early part of next year. So anyway, we can talk about that another time.
That'd be great, Pete.
Yeah, it'd be good to come over there and see. We can do more interviews, and perhaps I can do some bits and bobs over there to do some, I don't know, off the top of my head, do some workshops, with other people over there with pain and whatnot. That's what I do. It's what I seem to be good at. It seems to be engaging with people and have a bit of fun. When I do my workshops there, we always have a lot of fun, and they're never boring. They're very interactive and stuff like that. So,
I think you've got a lot to offer. I think people that have been affected by cancer need to know that they can ask for help, and not to put up with things that they may have developed since they've gone through their cancer treatment, and they just think that that's their that's going to be that for the rest of their life. Often there is people that can help, and so I think when we talk about it, we've got to say that there is help out there, and even if you haven't had that in the hospital system, there are therapists out there that are trained to help people that have been affected by cancer. So and the thing is, your window for rehab doesn't close. So even if you were diagnosed 5, 6, 10 years ago and you have some impacts of your treatment, because there are long-term side effects, you can still get help. And although that, the help may not make you completely 100% back to what you were before your diagnosis, it can have huge improvements for your quality of life, for your levels of pain, for how you sleep, for your energy levels, for your ability to go back to work. All those sorts of things we can have a big impact on. And so your window for rehab doesn't close. And if you've been affected by cancer, ask for help. There are therapists out there that are really good at what they do.
Lou, that's a fantastic take-home message to end the broadcast. And thanks very much for your time. And I know it's your beginning of your day, and it's coming up to the end of my day. But so I say thank you very much for taking part in the interview, and the information. I've learned a lot more information again tonight, which is very useful for me. So I wish you well. Have a great day, and I'll be seeing you soon.
Awesome. See you, Pete.
Yeah, take care.